Welcome to our show today. I am Angie Timmons, Cancer Control Specialist with the Kentucky Cancer Program. Today I'm joined by colon cancer survivor Doralyn Warren, a nurse who's also a Nurse Aide Instructor at West Kentucky Community and Technical College. Colon cancer is the second leading cause of cancer deaths in men and women combined in the nation and in Kentucky. The mortality rate in Kentucky is among the highest, claiming the lives of more than 800 people each year. Doralyn, thank you so much for joining us today. I know you have such an important story that shows the importance of screenings. Can you tell me when you got diagnosed with colon cancer?
Actually, I got diagnosed in July of 21. Actually was July 16th, and I had gone for my routine colonoscopy, and when he came back and the results was, you have colon cancer.
And you were shocked.
I think I wasn't so shocked until he told me my hemoglobin was 5, and then I decided I was already dead. But yes, it was a surprise because that wasn't what I was expecting. But when he told me that my hemoglobin was 5, then I knew, yeah, this is pretty much, I'm on my way out of this earth. Yes.
So you hadn't had any symptoms?
No symptoms. We had just taken a family trip, road trip, and we were in Florida, walked over 20,000 steps a day. We were there for 4 days, and nothing, no signs, symptoms, nothing. Going about my normal day. And I only went for my colonoscopy, and that's when I found out.
Yeah, so you would have had no idea just about what was going on with your body. You didn't feel anything.
No idea at all. And of course, I always tell my gynecologist she saved my life because it was just our conversation, and she said, I think you'll get a colonoscopy. And then I was like, okay.
It was just time for you to get one.
Yes, yes.
And how long had it been since you'd had one before?
It had been a while. It had been a while. You know, one thing about being a nurse is you have this tendency to take care of everybody else. And even not just in your family, you always take care of everybody else, and you always put yourself last.
And a lot of women do that too. They want to take care of their families, and they tend to put off their appointments. And then COVID also happened.
Yes.
And some screenings got put off by people that just said, I'll do it later.
Yes, yes.
Well, when the doctor came in, I remember you told me that you just thought you were going to have breakfast later that day. You had no idea.
Yes, and actually, Dr. McCombs was my GI, and I like pancakes. And so we were talking about, he said, I'm going to have you out early enough, go get breakfast. And so I told him, well, I'm going to get pancakes. And so we had that conversation. And from that, you know, when he took me back, you know, it was like, I'm going to go have pancakes after this is over. And I did not have pancakes because my blood count was so low. He admitted me to the hospital to get blood transfusion.
So just complete shock. I mean, you just didn't expect that to happen.
I did not expect that to happen, but after hearing, you know, once reacted to it with my children, because they were there to support me, you know, and then finally it was like, okay, God, you gotta work this thing with me and take me on this journey. And being a nurse, I knew what it involved and what it was going to entail, especially with me being an African American. I knew, you know, and so it was like I had to keep it moving.
That's right.
You know, very properly in this journey. Yeah.
Did you have any family history?
No family history that I knew of. You know, my siblings, of course, went for their colonoscopy. They never voiced to me they had polyps or anything like that. But it was after my diagnosis that, in really investigating my family or talking with them, and then it was found out that my first cousin was going through the same journey like a couple of months before me.
And you may not have known that.
I did not know that. Did not know that.
So after you got admitted to the hospital, what happened? Just tell us kind of a little what happened throughout that.
On that Friday night, when with my blood count being so low, he admitted me to the hospital to get a couple of units of blood. And so that was at that time that, you know, it was like life started happening, you know, having my children there, which they are adults and they have their own family, but that was the time that I had to really talk to them and say, okay, this is it, and this is a journey that I have to go on, and we're going to be very transparent. Even if I'm unconscious, you all still let me know what's happening. And then we just really, I just told them about life for me as to what is expected. Living will, this is this, all of the business aspects that they needed to know. Yeah. And it was very opening for me, because this is why you have to be prepared. Not expecting something like this to come into your life, but you always need to let your family know what's your next step. What is your next step for life?
People need to have those conversations.
Have it all ready, that it doesn't take this circumstance to say, okay, we need to talk.
When did you find out your diagnosis? As far as I know it was stage 2, is that correct?
It was, yes. Well, yeah, it was stage 2, because they did not know at the time until I had the surgery. And it was, so it is now that it is stage 2. It's like that in between the 1 and the 2. So it's very, low, and so the true diagnosis didn't come as to staging it until after I had surgery.
So, and what was your treatment plan? My
treatment was, I started in September. I went to see a surgeon, an oncology surgeon in Louisville, by my doctor's directions, and then after talking with him and Dr. Claudino, yay for him, then he started me with my treatment plan, and it was basically, I had chemo for probably 6 months, and it was a journey, and probably the most challenging thing that I had to learn was to truly listen to my body. And when it was saying that I'm tired, then you just rest. Just rest. But again, shout out to Dr. Claudino for his expertise, and for God anointing them, because I prayed for my medical team all the time, anybody that touched my body. And so he just really walked me through it. I went through the chemo with, the key thing that was with me was I was tired. I learned the definition of tired. Yes. I was still eating. I didn't have a huge appetite, but I ate what I wanted, and tolerated it. Didn't have a lot of nausea and vomiting. Thank God for that.
Thank goodness.
It was a journey that I had to learn the value of life.
Did you keep a positive outlook the whole time?
Oh, the whole time. Yeah. Yes, because this is what I did. I took this journey, and what I said to God was, I'm going to be your runner, and you're going to be my coach. And with a coach, you listen to the plan that they have for you. And the scripture that I chose was, no weapon formed against me shall prosper. And my weapon was the cancer. That's how I looked at it. God was my coach. I was the runner. I always want to run a marathon anyway. So whatever he was leading me to do, and there were some difficult days, let me tell you, but I had to keep my focus on, not on the cancer, but on the healing of what God had said he would do for me. And that's what I did.
And how's your health today?
My health is excellent. It is excellent. Yes, it is excellent. I still walk, because I'm always a walker. I probably, for my mental health, I learned the value of life. Life is a gift, and I open it every day as I was a kid at Christmas, when you get your Christmas gifts. And so I open it with such joy as I enter to each day. I'm so grateful, and I never say or wake up without saying thank you.
Yeah. You learn not to take things for granted.
Exactly.
And then you start your job here at the college after that?
Yes. Well, I actually started my job here in 2019 of October. And then we went through the pandemic and working from home. And then in 21 is when I had my colonoscopy. And then it was like, my thought was, I haven't been here that long, so I was going to resign. And then in talking with the dean and the coordinator of the end of the program where I work, it was not that, no, you don't have to. So WKCT nursing department, the dean, very supportive
That's
the
awesome.
whole time as I went through this journey. And when I returned to work, I returned to work.
Well, I want to talk about you. I know you feel like you have a message out to your community, like through your church and different things.
Yes.
What is it, the message you're trying to get out to people?
First of all, I have become an advocate because in meeting you and when you all were out here on the campus, it was like, I know I was just talking because I was so excited and so appreciative that I was able to do that. And then one thing that I learned is that for my community, for my culture, you know, we have to step out and not be afraid. You know, it's like, yeah, you need to go get your colonoscopy.
Yeah,
And
lots
really,
of African Americans don't get screened.
not so
Yeah.
often.
Yes.
You know, you have some that do, that follow the plan, but then you have some that it's like, oh, that's not necessary, or I'm going to treat myself, or you know, when it happens, you know, sometimes you have, I'm going to die with something, but you really don't want to do that. And
Right, you wanna be proactive.
To encourage them, and of course at our church, the month of awareness, I make sure that it is talked about and encouraging people to get their colonoscopy. But one of the things that I learned about myself was I had never had a primary physician.
Which a lot of
ever.
people don't.
I did not.
Yeah, they'll
you
go to
know,
urgent care or something like
because
that.
I was never sick, and that is so important to have a primary physician. I do now, okay? But you need a primary physician because they will remind you to go,
Right.
it's time for you to get this or whatever.
But do you feel like that, like your friends and family and church members will listen to you because you've been through it?
Yes, I feel like some have, and some have come and talked to me one-on-one and said thank you. You know, because it is not something that, because when you hear the word cancer, the first thing you think about, you're going to die.
Right, you don't want to think about it till it
And so
happens.
you don't want to think about it until it happens, whatever part of cancer that you may have. But there's so many great things that have been developed for the treatment of when you have a diagnosis of cancer. So that awareness,
Yes, it's just
I want to get
change
out.
every year. There's new technology and new treatments.
Yes. So it's you know, my thing is save your life.
Yes, and you're just a
Save
living
your life.
example. Of,
Yes, I am. I really am. Yeah.
Well, that's awesome. I just want to thank you so much for sharing your story. I really feel like you can reach people because you've been there. And so they'll listen to a lot of times to folks that have been there instead of someone that hasn't. So I just thank you so much for sharing your story with us today.
welcome.
Next, we're going to talk to a gastroenterologist from Mercy Health Lourdes about why colon cancer screenings are so important. Thank you for watching the second part of our discussion about colon cancer awareness and the importance of screenings. I am Angie Timmons, Cancer Control Specialist with the Kentucky Cancer Program. I'm joined by Dr. Chandra, a gastroenterologist at Mercy Health Lourdes. Thank you, Dr. Chandra, for joining me today.
Thank you, Ms. Timmons. Thank you for this opportunity. It's great to be here.
Well, we appreciate it because we know you're busy saving lives or treating people. So how long have you been a doctor?
Physician, I did my medical school in India back in the 1980s. I graduated from med school in 89.
Okay.
Then I came to the US and I did a PhD in molecular biology from Louisiana State University. Back in those days, I was very interested in becoming a physician scientist, and my area of interest was to develop cheaper vaccines, if at all possible, especially the ones that make a big difference in the third world. So the project I did at Louisiana State University under Professor Ronald Siebling was trying to see if I could get a bacterial system to make proteins of hepatitis A virus, which affects the liver, which is a waterborne illness. It's still there here and there in the US as well. And if we could make a cheaper vaccine, that would be much more beneficial for the third world in general. During the course of that, things were changing. Molecular biology was burgeoning. We had polymerase chain reaction. A lot of new technologies were coming in. And my professor actually had mentored a student who later on joined the CDC, and he was one of the pioneers who actually discovered the Ebola virus. He actually went there and he figured out that's a virus and named it as Ebola. So I was fortunate to have him as my mentor, Dr. Siebling. After that, I did my medical residency in Louisiana State University in Shreveport, then went to Chicago at University of Illinois in Chicago. So I finished my fellowship training in 2003, so for over 20 years I've been practicing gastroenterology, which I enjoy.
How long have you been here in Paducah at Mercy Health?
Paducah, it's almost 5 years.
Okay.
Yeah. Right before the pandemic, then we had the pandemic.
Yes.
And we got through that.
Yes.
And now here we are, and time flies by so fast.
Yes. Yeah. Well, I know so many people, when we talk to folks about getting their screening, they say, oh, I don't want to do that. They just are scared of getting colonoscopies. That's just something I guess you see every day in your office. So how do you convince someone that they need one and that it's going to be okay, that it could save their lives?
Yeah. It's, it's one of the very challenging things as a clinician, because they say some of these things they don't teach you in medical school, because you know the science part of it, you know what is the right thing to do, what is the test you have to do, and what is the treatment you have to do. But talking to a patient and trying to lead them through for their own better health is oftentimes a challenge. And on top of that, colonoscopy as a preventative tool, or a cancer screening tool, is probably the most invasive procedure, most involved, and also most time consuming, and also probably one of the expensive screening procedures. So wherein a patient has to not only be prepared even a day before the procedure, they have to change their diet, they have to drink this solution, which most people don't like, and then they have to go to the bathroom multiple times. It's like having a bad case of stomach bug.
A stomach bug, yeah.
You know. And on top of that, they have to have somebody else come with them, because we use sedation or anesthesia, and because of that, they won't be allowed to drive. They have to take a whole day of absence from work.
Right.
So because of these challenges, there is a lot of hesitation among people.
Yes.
And not the least of which is people worry about some problem happening during the procedure.
Yeah, they don't want to find out. They'd just rather not know.
Yeah, and especially it's true in areas where cancers are much more prevalent than in other parts of the country. So these are like several challenges, but there is no one right answer. When the patients ask, like, I'm not very interested in doing this, maybe I will think about it. But what we tell them is, whether we like it or not, there are some procedures we go through in life. It could be a simple thing like taking a driver's test.
Right.
You do the driver's ed for several weeks. I mean, you may be very good at learning driving in 2 days, but that may not be enough. You have to still go through the process. Or if you travel, you have to go through the airport and you have a metal detector. Nobody likes to be padded. Nobody likes to have the magic wand waved on front or back of you. And despite that, we also have to appreciate it is a preventative measure, because if we don't look for things and prevent them from happening, then we face a bigger disaster. It's kind of like the warning we get in this part of the country about the weather. It may be ice, it may be snow, or it could be a tornado.
It could be
Each one of those we appreciate to know beforehand, so we can put in place some measures to protect ourselves.
Just be proactive.
And to come out of it with as little damage or as little problem. And in the big picture, when we do cancer screenings, whether for breast cancer or skin cancer or prostate cancer and colon cancer, the ability to catch cancers, thanks to the tremendous advances made in technology and science, both in our country, a significant part has come out of our country and also across from the other side, like Europe and other places. If we don't take advantage of this, the price we pay is going to be much, much higher. And sometimes my patients tell me the prep is the worst. I cannot drink. I get
Yeah, that's what
nauseated.
they complain about is the
It
prep
is.
always.
So I have to reassure them we have ways of countering the prep related problems. Maybe I can put you on a medication that helps you overcome the nausea.
So there's some different options for
There's
people.
different options. So we have to explain it to them how we can get through those, and also not have the fear of like what if they find something.
Yeah.
They need to know plan B, because the fear of unknown is if they find something bad, is it the end of the road? It doesn't have to be that way, because we have a very good cancer department in our hospital.
Yeah, you have a new
so
cancer
you get
center
new
being
cancer
built.
center being built, and a lot of things that we once upon a time had to travel to a bigger city, we will have the capability to deliver it here. And even if you have to go to, say, for example, Lexington or Louisville or St. Louis or Nashville, you probably will have to make the trip only for the absolutely essential part of the surgery or things like that, but rest of it we are capable of
Yeah.
handling it here.
It's just amazing because we do hear people say, I just rather not know.
Yeah.
But if they could just find out, if you can find a polyp, at least you
Yeah.
can catch it before it turns into cancer.
Absolutely, absolutely. And many people, especially among men, it is much more difficult to
Yeah.
convince them, because women generally already understand the importance of preventative care, whether through their obstetric visits or
Right.
taking their newborn babies and getting the appropriate
Yes.
vaccination and things like that. Men, on the other hand, whether in Louisiana where I lived and in Tennessee or in Kentucky, sometimes I teasingly tell them, you are better in taking care of your truck, because if there is a little spot or something, you take it to the car wash without any hesitation, you polish it and do all these things. Why would you not want to take care of your wonderful body?
I've told my
the same
husband
way?
that exact same thing. Yes.
But a lot of the patients, once they express their fear or what is their hesitation, and they know there is solution for that, they are more inclined to do the procedure.
Well, you mentioned the different states you lived in, which are all southern states.
Yeah.
I mean, is there something about this culture, or you see more cancer in this area? Or?
The cancer, yes, of course. I mean, the culture, there are all small variations from place to place. Like they say, America, at least the United States, it can be broadly divided into 7 different countries if you
Yes,
want. You know, the
yes.
Southwest is its own thing, and Louisiana is all by itself.
It's all
a
its own,
different,
yes.
yeah, especially the southern part of Louisiana. Then you have the Northeast, and you have the coastal areas and Midwest and stuff. But in general, people are the same wherever we go. And the problem that we often try to see, this hesitation about getting procedures done, whether to go to a doctor, this is universal. This is not just here. And I grew up in India. I have friends who are practicing in the UK and in other parts of Europe, in Australia even. A lot of times it comes down to the accessibility and how much time somebody is willing to make for their own health in the preventative aspect, whether it's their exercise, whether they're paying the attention to their diet, how much they can take care of their health in that manner, and also how often would they go at least make a yearly annual physical visit, that sort of thing. But once people have that sorted out, the next thing is how invasive is this procedure? Is it like an operation? Will I be cut upon? Is there pain involved?
Yeah, they
These are
just
the
need
other issues.
information.
They need information. The more we educate, I think there'll be especially the younger generation now, they're more receptive and they have multiple ways of accessing
Yes, and
information.
I was going to ask you about that because we keep
Yeah.
hearing that younger folks are getting colon cancer more often. Do you see that?
We do see that. We are seeing a trend in people much younger have not only the colon cancer but other types of cancers as well. And the second more important thing is not only are they being diagnosed, like for example, when I started out in private practice in 2003, it would be very rare in a year if I were to see a patient younger than 45
Right.
having colon cancer, unless there was a strong family history. Those are people we know. There are certain syndromes like Lynch syndrome or
Right.
hereditary non-polyposis colon
genetic.
cancer, genetic tendencies. There we already know, or there is one called familial adenomatous polyposis. Those are high-risk conditions. But sporadic cancers, it was not that often. But starting about like around 2010, somewhere around the time I started seeing people in their 40s, not even 45 sometimes. They already had like colon cancer, and unlike in the old days, we would always associate colon cancer with iron deficiency anemia, patient feeling weak, going to their doctor, they would do the stool test is positive. Some of these patients would come for some other GI issues, and then lo and behold, while investigating that problem, you would find the colon
Well,
cancer.
I've always liked to mention the actor who played Black Panther.
Yeah.
You know, he was a young man.
Yeah, Chadwick
he played
Boseman.
he played
Yeah.
a superhero.
Yeah.
So I think in his death, he's going to save a lot of lives because it's just going to bring to mind that it could happen to anybody.
Yeah, he did. And Katie Couric, when her husband, he also was very young. He was younger than 50 when he got his colon cancer. She raised the awareness. And then Tony Snow, if you remember, he was President George W. Bush's press secretary. And he was one of the Fox News anchors, really nice fellow. And he developed colon cancer at a much earlier age.
Why do you think that's happening? Do you have any idea?
That is a good question, because even now the science has made a lot of progress, but they're not exactly clear why we are seeing this in the generation that is born after 1970. So we generally tend to see that, but there may be multitude of factors here, some of which could be, the genetics may still be playing a role. On top of that, our dietary patterns have changed, and there is more and more of the processed food dependency that we have had with all the two people in a family working, and you know, for the sake of convenience and stuff, foods that we eat, and
we're on our phones all the time. We're not getting exercise.
Active physical activity is another reason. Then, although the habits have been changing, there is still a significant amount of smoking and alcohol use in our area,
especially here.
Yeah, in this area. So that coupled with lack of information, so to speak, and then the outreach that there is still work to do from both the physicians and the hospital side, and also from the patient side. So there are a lot of different factors, they think, but maybe in the next 5 or 10 years we'll have a little better answer about what is causing this kind of increase in numbers. Do you think the age
for getting, right now it's 45, do you think it'll get lower?
Yes and no, only time will tell, because there is a good possibility it may just stay at 45, but like with other things, high blood pressure screening or heart disease screening, various these guidelines, they keep on changing. I do hope, for the sake of some of my patients, they're already reluctant in their 60s. If you tell them you have to start at 40, there'll be even more reluctance unless we do a better job at justifying why somebody needs it. Educating the people, and it's not only about the individuals, it's about the whole community.
Right, and we try to tell people this could save your life. I mean, that's what you got to look at.
And the majority of the people may not have any of the problems. They may not have any polyps.
It's just preventative.
But without screening a whole number of people, it's very difficult to catch who would be the person who has the polyps and who does not. It's kind of like, I use that airport analogy. Unless you put everybody through that metal detector, you don't know who forgot to remove their metal bangle or some other thing. They kept their phone in their pocket, But 99% of the people are aware. They take off their shoes if it's going to beep and stuff. But somebody will go through there and beeps. That's how we are able to implement more protective measures.
Well, Dr. Chandra, thank you, Dr. Chandra, for joining me today. Mercy Health and Kentucky Cancer Program partner with the Kentucky Colon Cancer Screening Program, a program that offers free screenings for people who are uninsured or underinsured. Remember, colon cancer screenings can save lives.